You're watching News 19 in HD. This is News 19 Daybreak.
Welcome back. This week is Men's Health Week, and this morning we are going to discuss some of the common myths associated with chemotherapy and why men should speak with their doctors about the facts before they get any treatment. And joining us this morning from Gundersen Health System is Dr. Alcee Jumonville. Thank you so much for getting up with us.
You're welcome. Good morning.
So, first of all, what are some of the things when men come in to talk about chemotherapy that they should be asking their doctor?
Well, aside from all of the issues related to chemotherapy and how it will affect their cancer when they're getting exposed to chemotherapy, there are a number of things that their physician and the patient need to discuss. If the patient has other medical illnesses or they're on other medications, that's always part of the equation. To discover what the interactions might be between the chemotherapy drugs and other medications they're taking, especially if they're taking medications that they've bought that aren't prescribed by a physician.
So what are some of the side effects that men can experience from chemotherapy?
Well, in general, most people don't think much of it, but men can lose their hair just as well as women. And that is a significant issue for a number of men, even though we don't tend to think about it. Men also, I think, uniquely experience a loss of image because the chemotherapy oftentimes saps a lot of their strength and energy, and men are quite used to being high performance and physical, and so I think the loss of energy and strength is a big deal. And finally, I think more than anything else is that for a lot of men, it surprises them that chemotherapy can cause a decline in their libido or their sexual drive, and that's a difficult thing to manage.
And can you go into detail a little bit more about the fertility changes, because I think that is something that is surprising for some.
Well, in the aspect of fertility, for young men who get cancer and who are still planning on their families, just like women with breast cancer who are getting chemotherapy, we need to be very conscientious about these folks because there are some chemotherapy drugs that will produce an infertile state. And if people are planning on having a family or if they're young couples, there's an opportunity to do some fertility management before chemotherapy gets started, but it has to be right up there, right at the front. And so we need to do a very good job of making sure that all those issues, especially for patients who are still planning families.
Well, thank you for these helpful tips this morning. A great discussion to have during Men's Health Week. And just the bottom line, talk with your doctor and ask lots of questions before you start chemotherapy.
I agree.
All right. Thank you so much. And stay with us. Alex is in next with another forecast.